Important simplified channel. So we are going to cover an important short note here, that is National Health Policy 2017 it was given, and it was a policy that is to be effective for 5 years, that is up to 2022. So the important short note is national. This is a short note, National Health Policy 2017, and it was a policy to be in effect for 5 years duration, that is up to 2022. Now let's look at the various targets of National Health Policy and the target years respectively. So first is the health status. First is going to be about the healthy life. So for healthy life, there are 3 targets, okay, given by National Health Policy. First is to increase in life expectancy at birth from 67.5 years to 70 years. So we need to, the first target was increase in life expectancy at birth. So increase in life expectancy at birth. So how much is the life expectancy before this policy? 67.5 years. Now we need to improve this 67.5 years to reach around 70 years. 70 years is our target, and this must be that achieved by the year of 2025. The next target is reduction in the total fertility rate. So how much is the reduction of total fertility rate? The target to be reduction of total fertility rate is to be reduced less than 2.1. So reduction in total fertility rate less than 2.1 is our next target. This is also the target year is 2025. The third one is DALY. What is DALY? Disability Adjusted Life Year Regular Tracking Trend. Okay, DALY must be having a regular tracking trend, that is 2022. Now this is all the 3 targets given for a healthy life. Now next, moving on to the mortality. So what are the targets achieved in under mortality? The first target is IMR, infant mortality rate must be less than 28. So the infant mortality rate should be achieved less than 28. So that is IMR should be less than 25 by 2025. So very important in reduction in the infant mortality rate less than 28, and by 2025 it is less than 25 must be achieved. That is the first target under mortality, reduction in the infant mortality rate less than 28. Now the next one is reduction in the under 5 mortality rate up to 23. So under 5 mortality rate, what is the target? 23 by 2025. Next is maternal mortality rate. Maternal mortality rate must be reduced less than 100. Okay, so maternal mortality rate must be reduced to less than 100, and by 2025 if you see maternal mortality rate can be reduced less than 70 it seems. So maternal mortality rate must be reduced less than 100 is the next target. And then the neonatal mortality rate must be reduced less than 16. Okay, stillbirth less than 10. So remember, neonatal mortality rate must be reduced less than 16 and stillbirth should be reduced less than 10 by 2025 again. So under mortality we are going to reduce the infant mortality rate less than 28, maternal mortality rate less than 100, under 5 mortality rate less than 23, and neonatal mortality rate less than 16, and stillbirth less than 10. Next, moving on to the disease prevalence. So under disease prevalence, what is our target? So we are going to, in HIV we have a target of 90-90-90. So in HIV we have 90-90-90 strategy. What is 90-90-90 strategy? Is 90% of deduction in HIV cases. Okay, so prevalence of HIV should be less than 90%, and among the 90% of the HIV patients must be treated, and among the 90% of treated HIV patient, the viral load remission must be there. That is this 90-90-90 strategy. So 90% of deduction, 90% of treated, 90% viral load remission. This must be achieved by the year of 2020. Next is the leprosy. Leprosy elimination. The current prevalence of India is 0.67 per thousand population. So leprosy elimination, the current prevalence in India is 0.67 per thousand population. So leprosy elimination must be achieved by 2018. Next is Kala Azar elimination. Kala Azar elimination is going to be should be ended by 2017 as our target. And lymphatic filariasis, the elimination also should be 2017, but now it is extended to 2020. So next is tuberculosis cure rate. Tuberculosis cure rate must be more than 85% and case detection must be more than 70%. Tuberculosis cure rate is more than 85% and case detection more than 70%. Next is your blindness prevalence. Your blindness prevalence must be less than 0.25 per thousand population, according to the NPCB program. Blindness prevalence should be less than 0.3. Remember, according to National Health Policy, the blindness prevalence must be less than 0.25 per thousand population. But according to NPCB, okay, National Program for Control of Blindness, the target must be less than 0.3, okay, per thousand population. So this is these are some targets to be achieved. Under health life, we saw the life expectancy must be increased, total fertility rate must be decreased, about DALY tracking, and mortality we saw IMR, under 5 mortality, MMR, and neonatal mortality rate and stillbirth. In disease prevalence, we saw HIV 1990, leprosy elimination, Kala Azar elimination, lymphatic filariasis elimination, tuberculosis cure rate should be more than 85% and case detection should be more than 70%. Blindness prevalence should be less than 0.25 according to National Health Policy, and according to NPCB should be less than 0.3. Now moving on to the next target. Decrease in the premature mortality from cardiovascular diseases. Very important target. So premature mortality or premature death, there must be a decrease, okay, in the prevalence of premature mortality or premature death from cardiovascular diseases, cancer, diabetes by around 25%. So there must be a decrease in the premature mortality from either cardiovascular disease or cancer or diabetes by around 25%. 25. Remember, the target age is also 2025. Next is health system performance indicators. So what are these health system performance indicators? So first target is increased utilization of health service. Very important. There must be increase in the utilization of health service by around 50%. And antenatal care coverage must be more than 90%. Skilled attendance at birth. Skill attendance at birth must be more than 90%. And fully immunized. Okay, the baby, all the children must be fully immunized more than 90%. Family planning more than 90% must be achieved. Okay, so what all will be coming under health performance indicators? Health system performance indicators. The first one is going to be increase in the utilization of health services. So how much percentage must be, what is the percentage of target to be achieved for increase in the utilization of health service? It is 50%. So 50% at least there must be an increase in the utilization of the health services. Next is 90 can be remembered for this also. Antenatal coverage must be achieved 90%. Skilled attendance at birth should be achieved 90%. Fully immunized must be 90%. Family planning 90%. So here also you can remember the mnemonic 90. So 90 for antenatal care, 90 for skilled attendance at birth, 90 for fully immunized, and 90 for family planning. All of this year is going to be 2025. It's your target year. Next is under non-communicable disease. So under non-communicable disease, what are the targets? First is hypertension and diabetes control status must be more than at least 80%. So hypertension and diabetes control status must be achieved for more than 80%. Reduction in the tobacco use. Reduction in the tobacco use, that is around less than 30%. Then stunting reduction. Stunting reduction must be there less than 40%. 100% of safe water and sanitation must be there achieved. So safe water sanitation is 100% to be achieved. That is our target. And reduction to reduce the occupational injury by 50%. Reduce occupational injury by 50%. So for under non-communicable diseases, we have 5 targets. First, hypertension and diabetes control status must be more than 80%. Okay, so the control status must be achieved more than at least 80%. Reduction in the tobacco use less than 30%. Stunting reduction, our target is less than 40%. Then 100% of safe water and sanitation must be achieved. Reduced occupational injury by 50%. Reduced occupational injury by 50%. So all these are the targets to be achieved under non-communicable disease. And the target year is mostly again 2025. Health system strengthening indicators. So what are the health system strengthening indicator? First is your health expenditure. Health expenditure to up to 2.5% of GDP. So the health expenditure must be at least up to 2.5% of GDP. All standards to be implemented. Okay, and establish health surveillance. So establishing health surveillance is another important target under national health policy. So we have covered the important question national health policy. We'll revise once again. National health policy was given 2017. The policy is in effect of 5 years up till 2022, but most of the target year is 2025. In under a healthy life, we saw increase in the life expectancy at birth, a reduction in the total fertility rate, daily tracking, mortality we saw IMR under 5, MMR, neonatal mortality, everything, and disease prevalence we saw HIV 90, leprosy elimination, Kala-Azar elimination, lymphatic filariasis elimination, tuberculosis cure rate and detection, case detection, blindness prevalence, and decrease in the cardiovascular death. Okay, I mean premature mortality due to cardiovascular cancer, diabetes, all this must be less by 25%. Then we saw certain health system performance indicators like increase in utilization of health service, skilled attendance at birth, fully immunized, ANC coverage, family planning. Under non-communicable disease, we saw hypertension and diabetes control status by more than 80%, reduction in tobacco use less than 30%, stunting reduction less than 40%, 100% safe water sanitation, reduce occupational injury by 50%, and health system strengthening indicators like health expenditure should be at least of 2.5% of GDP, and to establish health surveillance. This is all the targets of national health policy. Thank you. Please do like, share and subscribe for studying about further questions in common and other subjects. Thank you.